Hi, my name is Neli and I work for the NHS. I'm also 6 months pregnant and live in Hertfordshire. So I thought I would share my experience with COVID vaccination, the fears I had and how I approached this. I had my 2 COVID shots before I got pregnant. During pregnancy I had a booster, the flu and whooping cough vaccines. For the flu vaccine I knew what to expect, but when I got into the consultation room I was quite nervous about it because of my pregnancy. So I spoke with the pharmacist who assured me that I'm doing the right thing because during pregnancy, if I get the flu, the risks of complications are quite high. And I also pass some of my protection to the baby, especially important after the baby is born. For the booster, I wanted to assess the risk of having the booster versus the risk of getting sick. I knew that this is no longer a choice just about me, but also about the little one growing in me. So I wanted to make an informed decision. I looked into various sources, NHS official websites and guidance, the Royal College of Obstetricians and Gynecologists guidelines, and the UK National Health Security Agency. They all recommended the vaccine because it reduces the risk of complications, especially the risk of admissions into intensive care and premature birth. And at the same time there were studies from all over the world that the vaccine does not have any adverse side effects for the expecting mothers. So I booked the shot. At the same time I had to book the whooping cough vaccine and I was a bit worried if I can mix the two. The nurse who administered the vaccine explained to me that both vaccines were not live vaccines, they cannot multiply and I can combine them, so I had them both. I did have some minor side effects such as reddish hand, some pain and a headache, but I thought that these are minor inconveniences compared to the long-term benefits for me and my baby's health. All of this experience has taught me that I cannot escape from my fears and I cannot escape from making decisions for the risk we face every day, from getting a shower to skiing to giving birth even. And for some of those risks I can make decisions based on my intuition or past experience, but for others I really need to look for reliable sources in order to make the best decision for me and my loved ones.